The mandate of the Federal Ministry of Health is the provision of quality stewardship and services for the good health of Nigerians. In the light of this, what are the major significant proactive efforts, initiatives and programs of the Ministry of Health under the able leadership of the Federal Minister of Health, Dr. Osagie Ehanire? Let's talk with the Minister.
When I came here,
it was due
This situation significantly led to the twin problem of
the breakdown of the amount established to have been stolen and laundered.
What the federal government is doing is to provide.
Honorable Minister, Nigerians would like to know what efforts and proactive measures have your ministry taken to ensure adequate supervision and control of health facilities, governing boards and government health agencies in the country. This is actually one of your major functions as a ministry.
You're correct, yes, and that is probably one of the most challenging because we have a lot of the institutions you are talking about. If you put all the hospitals together, it's nearly 60 and growing. If you add all the agencies onto it, it's going to 90 something. And most of them have governing boards who are supposed to do exactly what we are saying now on behalf of governing boards. Look after the affairs of those hospitals or agencies they are supposed to be governing. But nevertheless, quite a few things slip between the cracks, which the ministry has to then address. And I do hope that the initiatives we are working on, which we have tried to put together, will soon be brought into the forefront to carry out reforms in these areas, to have a more efficient system, a system in which there is more confidence, people have confidence in, that has better trained, at least better motivated functionaries, not only doctors, but also nurses, pharmacists, etc., that will now make it possible for Nigerians to stay in Nigeria for treatment instead of going abroad for treatment. We have a tertiary standards committee, which we have just set up, and this committee has Nigerian experts from abroad, Nigerians who study and work abroad, who will be members and be able to bring their own experience from outside to join the Tertiary Health Standards Committee in looking at how the hospitals are run and what improvements they need to make. This is one area where we need a reform, a real strong health reform in the tertiary area to increase confidence in it and efficiency and improve service delivery for the citizens.
How effectively has the ministry evaluated quality health practices, developed guidelines for management and standard for performance?
This is one area where it is not only the federal government that is involved. The state government plays an important role here because the state governments are the ones who will give licenses for hospitals to operate in their states and also participate in supervising what goes on in the hospitals. Then of course you have the Medical and Dental Commission and also the nurses, the Association, Nurses and Midwives Council, who regulate the quality and practice of the individuals who go into provide service at our institutions. Again, here we need to set standards because many of these institutions were set up many years ago when we didn't have so many hospitals, when we didn't have so many doctors, so many nurses. But now that the population of doctors is increasing, more and more medical schools are coming up, the number of hospitals is increasing, and also the private hospitals, which also need to be regulated, they are all coming up. We're going to be working on reforms to improve or perhaps decentralize, because the more they are, the more difficult it is to cope with individual institutions. So we may need to decentralize, we may need to review the way we go about regulatory activities of hospitals.
How effectively and efficiently has the ministry sustained the services for the registration of public and private health agencies operating within the country, plus evaluation of functions and monitoring of their activities?
The health institutions are registered by the state government, the hospitals. The state, like the FCT, does its own registration. They have to register and give them permit to operate. The federal government, the workers in there have to meet the qualifications to work in there. But the institutions themselves have to be given an operating license by each state, and if the state doesn't give you an operating license, you are not going anywhere. As far as the NGOs are concerned, it's a joint effort. They come in, foreign NGOs, for example, come into the country and have to be registered with the Ministry of Finance and Budget and National Planning. That's where they set their standards. But we are looking for ways to better harmonize what they do when they come in here. We have a health partners coordinating committee, of which we must begin also to bring all those who are operating into the country, into that umbrella to harmonize what they're doing, because there's sometimes conflict in what foreign partners do in here. Some areas are overserved, others are underserved in the services that are provided by foreign organizations, and we will need to make the best use of what they bring in here by better monitoring what they do and the innovations they bring in.
Thank you very much, sir. Now, with a view to boost healthcare delivery in Nigeria, what is the nature and level of public-private partnership in the health sector to bring about an upgrade of health services?
The private sector in Nigeria actually offers up to 60% of the services, more than the public. Although there's a bigger question of affordability there. A large number of people are not able to afford the private sector, almost like education too, and private schools and public schools. We're also happy for the emergence of private hospitals, because together constitute a very significant value addition to the health system. And many of them are very high level work, high level surgery, high level services that in fact in one or two cases some of our teaching hospitals are trying to meet up with. If you look at the newest initiative that's coming up now, is the National Emergency Medical Service and Ambulance System, NEMSAS, which intends to provide health services to Nigerians in emergency situations. Now, this is a classical PPP where the assets of government are going to work with the assets of the private sector. In ambulances, for example, they have more ambulances in the private sector than the public sector, who are going to come together to be available to give emergency service to whoever is in need and dials a number 112 and is directed to a call center, which should locate the caller, locate the nearest ambulance, and send the ambulance with trained paramedics, provide service, and take that particular patient, where necessary, to an urgent care center or to a teaching hospital to give them treatment and then refer them to a definitive treatment spot. Now, we're working there with the private sector in a unique way. It's innovative, and for every one of these services, the person who's receiving the service will not be charged at point of care. It will be paid for by this system. That will save a lot of lives, because the argument about who is paying for you will be removed. And the fund is being created to assure the beneficiaries, and the health providers, they are assured that they will be paid, which is the special point about this program.
To what extent has the ministry developed capacity for the purpose of generating evidence-based data?
Data is extremely important, and also the collection and management of data is critical here, and we're continuing to build on it. The health insurance also working very hard to create that for management of its cases, of its clients that are registered in the insurance service scheme.
Honorable Minister, on a final note, what are the future projections of the ministry to ensure safe, affordable, accessible, quality healthcare delivery system in Nigeria?
First, we want to look at the various layers of healthcare. First is the community health, based on the primary healthcare center. That is to say, the infrastructure, the human resources, the equipment, and then the commodities and wherewithal to run primary healthcare system efficiently. Secondly, a mechanism for delivering healthcare in emergency, because not being able to attend to patients in emergency is responsible for the large number of loss of lives. Women who are delivering, for example, have obstructed labor, or children who have a pneumonia, or those who have had an accident. So developing a medical emergency service is the next. Then the next layer is the general hospital, where referrals go to from the primary healthcare or from private centers. And finally, a reformed tertiary hospital system that functions efficiently, respectfully, and treats their patients with dignity and is productive, that we have such confidence that nobody wants to go abroad for treatment again. All this will be enabled by the primary healthcare system, the secondary health system reforms, the tertiary health systems reforms, the creation of a national medical emergency ambulance system, and then all driven by the NHIS, National Health Insurance System, State Health Insurance System, Community Contributory Health Insurance, which is already going on in some states, like Kano. And of course, all of it supported with a very sound public health system and all overseen by the Federal Ministry of Health.
Honorable Minister, Federal Minister of Health, Dr. Osagie Ehanire, thank you, sir, for coming. You have a final word to Nigerians and all stakeholders in the health sector.
And my word to Nigerians is accept the vaccination that is going to be given now. If you are receiving 2 doses, turn up for the second dose. Even if you are vaccinated, use your mask, avoid unnecessary travel, avoid crowds, keep social distancing, use sanitizers, do not go out unless absolutely necessary, and keep safe. Take your vitamins. I think that will take care of the final words to avoid coronavirus, which is a threat we have with us at the moment.
The minister has spoken, and it's quite obvious that the Ministry of Health, under his leadership, is making giant strides, all in the bid to make sure that the health sector is not only active, but also vibrant. We'll be speaking with Dr. Osagie Ehanire, who happens to be the Minister of Health. It's been quite interesting. Like we said, we'll be updating you on fresh developments from the ministry from time to time on the Minister's platform. The Minister's platform will continue in a moment after this time out. Stay tuned.